Fish oil supplementation during pregnancy prompts improved memory in children. Youngsters brought into the world to moms who took fish oil in their pregnancies have been displayed to have quicker critical thinking abilities and better consideration center at age 10, as per discoveries from an investigation introduced today at the 6th World Congress of Pediatric Gastroenterology, Hepatology and Nutrition. Fish oil supplementation during pregnancy prompts improved memory in kids. This is the main examination to analyze the drawn-out impact of maternal supplementation with fish oil and additionally 5-MTHF, folic corrosive, on the resting state organization, RSN, working. This is resting mind action when an individual isn't occupied with an intellectual or dynamic assignment, of youngsters at young and was financed by the European Union. The kids were evaluated at age 10 utilizing expert RSMRI cerebrum checking to quantify RSN, close by neuropsychological testing. The aftereffects of all gatherings were then analyzed for contrasts. Teacher Dr. Berthold Koletzko, head of the Division of Metabolic and Nutritional Medicine at Dr. von Hanner Children's Hospital, University of Munich Medical Center, Munich, Germany, is one of the examination's creators. Educator Koletzko says that kids brought into the world to moms taking the DHA-rich fish oil in pregnancy showed helpful impacts with quicker handling speed when tackling complex issues, and better outcomes in consideration tests. The outcomes exhibit that the nature of maternal supplement supply during the time of quick early mental health in pregnancy, lastingly affects later mind work at young. Study explains the advantages of MG supplementation during pregnancy and in chemical-related conditions. Expanded degrees of moderate and overwhelming actual work can control blood vessels solidifying in kids. Offspring of accomplished guardians endure more frequently than others. Accordingly, ladies previously and during pregnancy ought to be upheld in accomplishing a decent quality eating regimen and be guided on potential fish oil supplement use. Organizer of the investigation and director of the EURISTIKOS Excellence Center for Pediatric Research at the University of Granada, Spain, Professor Cristina Campoy, adds, "Our examination gives proof that kids brought into the world to moms who had taken fish oil during the second 50% of pregnancy had improved memory." Fish oil supplementation was related with lesser useful availability of youngsters' cerebrum organizations. However, this didn't show poor psychological neurodevelopment, fairly the inverse. Folic corrosive supplementation didn't prompt obvious alteration of mind work measures. The investigation by scientists at the University of Granada, Spain, circled back to 57 offspring of moms from a past research program who had been given 500 mg of docosahexaenoic corrosive, DHA, and 150 mg of icosapentaenoic corrosive, EPA, fish oils each day, either with or without 400 micrograms of 5-MTHF, folic corrosive alone, or fake treatment, during the second 50% of their pregnancies. The creators focused on that albeit the example size was little, an enormous number of approved methods had been utilized to evaluate their theory in the examination and the information came from a grounded companion, a gathering that is being followed up long haul. They added that the outcomes ought to be deciphered as fundamental information and can't be considered to have general application, with additional exploration being required.